And I'm happy to present this particular or engage in conversation with you for this particular segment of interscholastic athletics. And so my question, how effective is safety, health, and well-being emphasis in your interscholastic athletic program? So that's my question. And then I follow up with COVID-19 contingency plan. I'm going to share what I was able to develop for my school prior to even getting here. Have you developed one? That's the question I'm asking. Have you developed one?
Yes.
Okay. Here's the answer.
Yeah, he's over in the other room. So yes.
Okay. The second part, PPE. Now, we're not talking about protective clothing for the COVID-19, but this particular acronym, as you can see, Pre-Participation Physical Examination or Evaluation. Does your school do they have a requirement for that before your student athletes try out for a school-sanctioned sports team? Does your school have a PPE as a requirement before they try out? Okay. I'm just kind of getting a sense of how neither does mine yet. And then finally, student athlete safety. Student athlete safety. What am I referring to when I have that phrase up there? What am I referring to? What do you think it means?
Maybe safety in the field, that they don't injure themselves, maybe?
Say that again?
Maybe that they don't injure themselves.
Don't injure themselves, okay. Anyone else? Student athlete safety. Okay. I'm going to go into that primarily. How many of you have heard of Emergency Action Plan? You've heard of it? Okay, sort of, kind of. Now, I know ISU has a risk assessment, which is very detail-oriented. But what happens if you're coaching or you're teaching outside in a specific area of the school? You have an accident. It's an emergency. What are you going to do? Who are you going to contact? And how is that going to happen? So, it is paramount or a priority that, from an athletic department perspective as well as the school itself, that you have a well-identified, written, posted EAP, Emergency Action Plan. And so I'll cover that as well. Oh, I think, okay, have you developed one in case of an emergency situation at a training and or competitive game site? Okay. All right. So going into this contingency plan for COVID-19. And I actually I worked on this and submitted it to our school administrator probably in July. And so hopefully, I'm just going to show you some of the detail associated with it. Oops, what happened? Let me go back here. Alright.
That's your CPR First Aid.
Yeah, you know, I need to go here, but oh, here it is, okay. That's, I have to keep it small in order for it to bring up the document. Okay. As you can tell, I'm not the most technical athletic director, technical knowledge athletic director. Why is it? Oh, okay, here it is. Does this board move? No, I guess.
You should make just slightly bigger. I've got the plus sign on top
The
for,
plus?
for zooming.
Come on, help me.
Sorry.
I know it. Oh, this one?
Yeah, just you basically put it bigger.
Okay. All right.
We don't have touch.
Oh, now okay, okay,
Okay.
okay. Oh, well, thank you for your assistance.
Can you put it back again? Was it-
No, there it is. Okay, so you can move. No, you can't move. Okay, so we started off with facilities cleaning, and these were some of the recommendations that I had to identify myself initially, and then I just transferred it to our staff. Okay, now, yes, please. And then, prior to sport practices training, we need to, okay, these are all basic types of, and I put this, coaches may consider having a student which has an interest in the position as serving as a student manager, et cetera, et cetera. Okay, so we have note, age of eligibility, number of participants, so these are all logistical areas. Okay, we can keep going. Now this was for the school, just in terms of rotating the training days. Now, entry to and exit from the campus. And again, this is all tied to a contingency plan due to COVID-19. So no one, including student athletes, should be allowed within the sport practices or training workout areas without first being cleared by ASU security. How many of your schools have that type of clearance? Or the security guard just open up the gate and let them in? Okay. Okay, ma'am, if you would. So we had entry to the gym or outdoor field for sports. And many of you are going through this. You're doing the pre-screening, right? With the temperature check. Okay. And what we actually use, the teacher coaches posted at the entry station will utilize a monitoring form for attendance and so we're documenting the data that we get so that we can trace back if we have to. Okay, and then I went into the list of symptoms associated with possible COVID-19 virus infection. Okay, continue now. And then, of course, I have concussion protocols. I'm not going to open that, but if you log into, as the Bowtie AD was explaining, National Federation of High School Associations, these presentations are free. So just log in for teacher, free, and they have the selection, pay to free, and then it'll come up a schedule of free courses. How many of you have taken, how many of you know what a concussion is? Okay, and how to identify potential signs and symptoms, and then what steps to take next. Anyone? I know we have this gentleman here. What about you? Concussion.
You can see, for example, the eyes, you can check after, the person had, for example, the head injury. You can ask them for a few things, like, for example, trying to walk in a line, checking their eyes, if they're focused or not, or if they have signs, for example, of diarrhea or, not diarrhea, sorry, vomiting, or headaches, and stuff like that. Sometimes it happens a few hours later than after the shock. It doesn't have to be straight away, they're going to get sick, but within 24 hours, if they're sick, then you see someone very quickly.
Now, if once you learn about identifying the signs and potential symptoms, they're playing a game. What are you going to do? What are you going to do?
Stop immediately.
Say that again.
Stop immediately.
And?
Stop that, and then probably talk to a school doctor.
Okay.
And then probably the school doctor can make a further decision and let the parents know and further protocols or whatever they follow.
Now we're in the middle of a game, but you recognize signs that a possible concussion occurred. However, the game is going on. What would you immediately do?
I'm going to have to ask you to lie down and call an ambulance.
You got to get them out of the game. If they're playing, you call that timeout, get them out. Sit. Then send your manager. That's why you have to have these procedures set up. What happens if? The what if. Okay. Okay, we can just these continue up if you would. So string, yeah, you just gonna scroll through so you can see how detailed I was. I didn't make this up. I just pulled it from cited sources. Okay, yes, okay, we can finish with that. Okay. No, we can just close it out now, and then just go back to the. Okay. Now, since we are in volleyball, I thought it would be, we're in the volleyball training phase, I thought it would be interesting to see what the Federation actually wanted those who are participating at the world level would do. Okay, slowly. Okay, continue. No, you can go up if you would, please. Continue, yes. Now these are for national teams. See, and this is what I like. This document is meant to provide guidance to continental volleyball confederations, national volleyball federations, and national volleyball leagues. Okay, primarily for, here we go, and we should know this, but they're sending it out in every basketball, World Cup soccer, volleyball here. Okay, just they're sending out their contingency plans. Okay, continue. There's one, let's see. Okay, wait, move it down just a little bit, right here. Okay, same thing. Are required to implement comprehensive safety and protection measures to ensure the health and well-being of athlete fans. So, how many have heard what's going on in the United States now with NBA and NFL? NFL, the National Football League, and the NBA, National Basketball Association. Right now, they want the collegiate teams, NCAA Division I, the big schools, they want them to play. But the NFL, which are playing now, games have been canceled recently because of what?
Because of the pandemic?
Yeah, because their infection is going around. But you don't hear about that in NBA, National Basketball. Why? because all of those teams and their coaches, all those players, they're in this bubble. And there's no one getting in or going out. And they're tested every day. And that's why LeBron James and the Lakers, they're playing for the national championship now. But you don't hear anything about anyone being infected with COVID-19. So the protocols and the setting where you are, and even for us, we have to restrict people coming in, and even those who do come in, they have to get their temperature taken, they have to have that social distancing, and really it's just for teams itself and a coach. And of course, the medical professional. Halas, that's it. Okay now, all right, we can close out of it. Any questions on this? Okay, I'm gonna move on to the next, let's see, what do we have? There's that on that slide. Okay, all right. Okay, so I wonder if we can go to the second link, if you would, please. Now, pre-participation physical evaluation exams. I am pushing hard to get that as a requirement for the school. I may have to go back to that little. No, so we're trying to get the, yeah, that one. Okay, we'll go to the, yes, now. Why is that not opening up? I thought you just click on it and then the video would come up. All right, as we're going on, my experience has seen that. Okay. Why is it important? Why is it important that a student should have? Okay. Yes. Okay, and he'll explain to you some of the aspects around. What is the importance of a pre-participation physical? If it ever is coming out. Now, these exams are to help athletes stay healthy and safe during training and while competing. Okay, this should. Okay, here we go.
I think it's very important for the pre-participation physical that each athlete gets to see their own physician that's already familiar with their family history, with their medical history, and with any other conditions that they might have, because those are essential to be addressed as well during a pre-participation physical exam. It's also important that the athlete not try to go to the physical and not be honest with the physician about any current problems they may be having, things that may need some rehabilitation, injuries that haven't been addressed yet before they start that season. It's key that the physician be aware of the requirements of the pre-participation physical, so it's always good to have those forms filled out and at the physician's office well in advance of when the athlete goes for that physical. And in most cases, it shouldn't be just a sports clearance physical or a pre-participation physical. It should be the annual or periodic examination that each of these student athletes has with their own personal physician.
Okay, we can take that one down. Why is it so? Yes,
I'm sorry.
Go right ahead.
Considering that, especially these smaller schools, we have students who participate in more than one sport
Right.
throughout the year,
Okay.
and like we said, even CCAs after school.
Okay.
Would it be better to have them have that checkup before each
No.
team start?
Once a year.
Okay.
So, if they were playing, let's say, the middle of the year sport first,
Yeah.
they should have it before that.
Okay.
Or, if they're playing more, okay, thank you. If they're playing more than one team sport, like you said, 3 at the beginning of the school before.
I was just thinking of what our doctor just said about the last one we attended before. is that if there's an overuse issue, and they just keep going, it's gonna be a really big deal. And so that was my thinking, is they do it at the beginning of the year, and let's get them going, and then another one if they're changing sports. Because maybe something happened in this one, they're like, oh, that's not my sport anymore, I'm gonna do this one.
Right,
But
right.
that could be aggravated, and we have a continuing issue.
Could be, but that's why it's important that they have the records.
Okay.
Follow them. So, and you go to the physician, like being at a clinic like SOS, then you'll have that record there. Plus, you look at the family history and what potentially could be there. That doesn't mean that they'll be restricted, but at least we know. At least we have the information on file at school, sir.
How are you implementing it to ASU? How are you seeing that? Where are you advising that your students to go and ask or check out? For your school specifically, how are you going to do that? Where are you going to get your students to go when you're coming to go?
Because it would be part of the athletic policy for participation.
But where would your students want to go and get checked?
Normally, it would be like they advocate, and many healthcare professionals advocate that they go to their physician, someone who knows them.
So they might just have a form to take with them?
Right.
That these things were all checked?
Right.
And we're good, or?
Right.
Okay.
And we would supply the form because it's pretty in-depth.
Okay.
But it would be better for them to go to, now, people say, well, it may be too expensive. And then again, another way is to be able to potentially contract with a clinic like SOS and then set it up at the school to whereas those medical professionals would come to the school, and it may be one day for the boys only, with male doctors. And then another day, girls with female doctors. No male and female. And then, I have that done at one of my schools, at private school in San Antonio, Texas, Dr. Paul Zions. He became the head medical professional for the San Antonio Spurs, and eventually went on to the World Championship status. He was a medical sport doctor, and his group, his team, I talked to him, communicated, and I said, I don't know how I'm gonna get this done. He said, you know what, Mark, I'll bring my medical team to the school and we can get it set up. It went like that. Just went like that. Every room, and there was no private. I stepped out because there was girls. I stepped out. Because you never want to put yourself in a position where an accusation could be made. So, this is, okay, I only got a few minutes. I wanted to show you, is everyone certified? CPR First Aid, AED certified?
Certified.
Okay, good.
Expired
When did it expire?
2-3 years ago.
So-
Certified 5-6 years ago.
Yeah, I would definitely advocate recertifying. Because what happens if one of your students, they're right there in front of you. All right, so emergency action plan, what is it? How should, okay, are we ready?
Yeah, we're gonna finish up, yeah.
Okay. So, I wanted to show you this, but can you go to this link for me? Anyone can save a life. And then I was going to go into knee pads for volleyball. I was going to go from here to here, but I'm running out of time. Okay. Program implementation. Who is responsible? The athletic or activities administrator must oversee and coordinate anyone can save a life for after-school programs. Now, I'm not advocating this to be done, but what I am advocating to you is take a look at this particular website. Because in essence, you got to get emergency. You're the only coach there. You should have already practiced with your team who would be the one to go call the emergency. Okay, you go call. They should already be pre-identified. So if it happens, you're there with them. Hopefully, you're there assessing. You already got somebody to call, you got someone doing this. So this explains how anyone can save a life. You're not just on an island by yourself. So, sorry I didn't have the time to go over everything. Any questions?
Because this will be provided to us, right?
Yes, of course.
Thank you.
Of course.
Thank you.
Okay. So how do you feel in terms of, just over the few things that I covered, how do you feel, how effective is your health, safety, and well-being of the student athletes or students in your program? How do you feel the emphasis, or do you feel it's emphasized about the health, safety, and well-being? Yes, no?
Don't know. I'm not involved with it, so.
But
I'm
even
not involved.
for the elementary students?
Oh, we're definitely emphasizing their health,
Okay.
safety, and well-being, you bet.
Okay,
But as far as the details you're speaking of, that'd be Mr. Jones.
okay, all right. What about here?
I ask a question.
Okay. What my question was, it kind of goes back to, oh, you can take that one. It kind of goes back to the original question.
The well-being is.
How do you feel?
how
Is it emphasized in your program the way it should be? The health, safety, and well-being of the student athletes in your program.
I definitely, I'm actually very new to
Okay.
the program, so, but I definitely see issue. We need to do this, make it posters, make it clear for who is responsible for what and
Yes.
stuff, so definitely needs to be developed. That's what I see for our program.
Okay. And I wanted to show you a copy of the emergency action plan, but I ran out. But again, it'll be posted on there. And I appreciate your participation. Thank you.
Thank you.
For